You're watching CTV.
Today, the whole world is living in fears and panic. The entire globe is rattled over the coronavirus, otherwise known as COVID-19 pandemic. This virus was first discovered in Wuhan, China in December 2019, but today it has reached every continent of the world. COVID-19 is also here in Nigeria in ways and forms that make life difficult. The first case of the virus was discovered in Nigeria on the 27th of February 2020, and the number of infected persons as of today stands at 184, with 20 persons discharged and 2 persons dead. Lagos State and Federal Capital Territory seem to be the places with the highest infections on record. The federal government of Nigeria has ordered and commenced execution of a total lockdown of key places like Abuja, Lagos, and Ogun states. While a total lockdown may be effective in reducing the spread of the disease, it comes with its own consequences, namely a resultant hardship for the middle and lower classes of people, such as petty traders, farmers, artisans, public transporters, and the rest. Unfortunately, this set of people form a whopping 85% of the total population in Abuja, Lagos, and Ogun states. They may escape the virus, but the hunger that would follow may be inevitable since they thrive on a daily income basis. In fact, one of the obvious downsides of the lockdown directive of the government is the reality of food scarcity among the local population. A good number of Nigerians live on their daily incomes. The lockdown directive impacts on their work and on these daily incomes. It's against this background that the public compliance to the lockdown order in places like Abuja are facing daunting challenges. It does appear that the government did not do well its homework by providing stimulus and palliative packages to the public before embarking on such a public directive. Besides the fate of the daily income earners, is also the absurdity of the hike in the price of foodstuff and other essential commodities in our urban and rural markets arising from lockdown directives. We would urgently require the market regulatory agencies to hound such robbers in our midst and bring them to book. It will be tragic at this time in our national history to contend with such greed around us. Since Nigeria continues to experience an exponential increase of confirmed cases of infection without sufficient concomitant response or palliative strategy, it will be urgent to key into the UN Global Humanitarian Response Plan to mobilize international funding in support of both direct public health and indirect immediate humanitarian consequences of the pandemic. In the face of this critical moment, Caritas Nigeria-led multi-personal coordination will be essential to ensure an effective and robust response to the COVID-19 crisis in the worst-hit areas through campaigns for the poor. From within the Catholic community, Caritas Nigeria would engage the Justice, Development, and Peace Commissions and other credible community-based organizations in their localities to direct responses in this trying time through mass mobilization and awareness creation. Besides mass mobilization and awareness creation, the provision of technical support and coordination in the states are also crucial. Caritas Nigeria is positioned to render such technical assistance in the areas where these services will be required. This follows the call from Pope Francis for cooperation, solidarity, and ensuring assistance reaches the most vulnerable of the society in affected countries. Prayers. To the general public, we pray that we observe with devotion the lockdown directive in order to contain the transmission of the virus, without which the scenario in other parts of the world will be repeated in Nigeria. 2, Caritas Nigeria would request Nigerians to abide by the precautionary measures with a deep sense of devotion, especially the social distancing directives and the personal hygiene requirements. This is the way to go in the containment of the pandemic. To the Nigerian philanthropists, the 15 billion naira already raised are great contributions to cushion the adverse effect of the virus. There is still the need to intensify more donations to ensure the provision of test kits, equipment of isolation centers, and the provision of personal protective equipment for health and allied workers. To the state governments, it's a pity that most of the state governments, apart from Lagos, are not yet up and about their duties. The provision of equipped isolation centers with minimum of 200 bed spaces should be a matter of urgency in all the states to cushion any form of emergency outbreak. To the federal government, to provide a transparent database of the poor and the most vulnerable who should benefit from the government's palliative support. To collaborate with the civil society organizations and community-based organizations for a more grassroots approach to the distribution of stimulus packages to the most vulnerable households. To ensure the judicious and transparent use of the donations and the records are to be kept in the archives of history for posterity to reward such gallant men and women for their deep sense of patriotism and solidarity shown in their donations. To expand the number of test centers, medical supplies, and more laboratories, it is laughable that 7 testing centers for 200 million citizens in this country we know are grossly inadequate. To take a look at our correctional centers, the congestion in the centers and the social distancing requirements are impossible to work together. And then to all of you, gentlemen and women of the press, at all levels of information platforms, the need for authentic information cannot be overemphasized. Fake news on health matters could be even more dangerous than the virus itself. Finally, Nigerians are very courageous and resilient people. We would triumph over the pandemic. Let us do away with fears and panic. God would save us from the pandemic.
You are watching CTV.